Welcome everyone to our health and social care conversation. You're very welcome and it's nice to have you all here joining us. We are using Zoom today, so please use the chat function at the bottom of your screen. You'll have seen that we are recording, and we will just be recording the inputs, the presentation. We won't be recording the discussion. And if you're more comfortable with your camera off, please do that. I am Sheena Arthur. I am Partnership Manager for Glasgow Council for the Voluntary Sector for Health and Social Care. Can I just check that you can hear me okay, because I can't see the screen. Oh, thank you. I've got a few thumbs up. Thank you very much. I can't see myself on the screen, so just wanted to check. I'm Partnership Manager at Glasgow Council for the Voluntary Sector, and with a specific remit around health and social care. And my role is around improving the relationship between the third sector and statutory partners. And in particular, I have a role within the Maximising Independence programme, which I'm sure Stephen is going to mention shortly. And that's really about our partnership working across sectors and about enabling and promoting independence as much as possible across the city. We are delighted. This is the first of a series of conversations that we'll be having, supporting conversation between the third sector and looking at the health and social care partnership strategic plan. And we really want that to be a conversation. And we've got time, you'll see in our schedule today, we've got time for an overview, a bit of discussion, some question and answers. And we really want that to be as purposeful and meaningful as it can be. We appreciate everyone's time is valuable, so please make the most of the session today. I also want to acknowledge we've had a lot of engagement events over the past year and beyond, and our World Reimagined series, and we've really heard some personal stories, some organisational perspectives. We've heard from carers, from families, from people working across all sectors, and some of that has been difficult. It's been a tough couple of years. We're all working through various things, and I just really wanted to acknowledge that before we start, that we really appreciate people sharing, and we know it's been difficult, but we really want to have a space for a respectful conversation, for feedback, for suggestions. And the team, you know, Craig and Alison, who are leading this strategic plan work, are really keen that this is a conversation, and it very much fits with our partnership approach. So we do want to create a space for discussion and honesty, but also based on respect as well. And if there's anything that comes up that's more of an individual issue, then we can pick that up. We will be taking notes of the themes that come up, as we always do, so that we can pick up and have further conversations with partners. So just want to acknowledge that. And I'm going to pass over to Stephen Fitzpatrick. Delighted that Stephen is here as one of our key sponsors of the work, of our partnership work. And Stephen's going to give us a perspective on the challenges, priorities, and the ethos of working together for the city. So delighted that Stephen is here, Assistant Chief Officer at Glasgow Health and Social Care Partnership. So I'm going to hand over to you, Stephen, and look forward to the conversations. Thank you.
Thank you, Sheena, and I'm kind of working off two screens, so if I'm not looking at you straight on, I can never quite figure out Zoom. I was in a wild panic there because I'm so indoctrinated into Microsoft Teams there. Craig had told me, but I'd forgotten it was on Zoom, so I'm on my iPad as well as my work device at the moment. So I see someone's helped me with the slides, so I'm grateful for that as well. And as you say, I'm here to provide an HSCP input on the challenges and the priorities and working together for the city in respect to health and social care. And you've already touched on it, Sheena, but I did want to just kick off by thanking everyone here on behalf of the HSCP. It really has been a hellish 2 years for everyone, I know. And I think the community and third sector organisations in particular really rose to the moment of the pandemic. From a standing start, we didn't really know what to expect at that point. So really grateful for that from the HSB's perspective. And also in terms of the context for the conversation we are going to have today, want to recognise the toll the pandemic's taken on everyone in society. And as we look forward, specifically in terms of this plan for the HSCP and the wider system over the next few years, that's not something, we can't just brush that away. That's something that's happened to us, and we need to face up to that in terms of our thinking about how we face the future. So in the context of the pandemic, I think that it's really delivered us to a point of radical change in the health and care system. I think we really are at something of a tipping point. This is different maybe from where we've started from in previous strategic plans over the years. And I think there's a number of converging forces that's driving us in that direction. After a kind of prolonged period of stability, really, relative stability, things are moving and shifting quite quickly and quite fundamentally. So everyone here will know that we've experienced the most prolonged funding squeeze for health and social care in memory over the last decade. Although I think post-pandemic, there's been a clear shift in the appetite to increase funding of health and care, which obviously has extended to the imminent increase in national insurance. So that's in some ways a really significant barometer of kind of political perspective on the challenges that we face. We've obviously got a rapidly ageing population as the baby boomers reach their golden years, and we're seeing that in our projections. Clearly not a surprise. We knew that was coming for decades. The Scottish Government has signalled a departure from the market commissioning model of the past 3 decades as well. What will replace it, I think, is still unclear, but that is also a really significant point of departure. We've obviously had integration over the last number of years, but Audit Scotland and others have expressed their concern about the lack of pace around integration, and that also forms part of the context for us. We know technology is moving really quickly in our lives, and the health and social care is no different, and that will continue to accelerate, and it's something that we want to encourage as a positive going forward, try to harness that. And of course, there's the impending kind of upheaval organisational structure-wise in relation to the new National Care Service over the next 3 or 4 years as well. So all of those things together, I think, make this, make it the case that in all key aspects, the conditions that we're operating in collectively are changing fast. So policy, funding, structures, and the kind of commissioning procurement context as well. And I think for me, in terms of the strategic plan and what we're talking about today and in future sessions, it's an opportunity for us to shape and influence these changes for the people of Glasgow. We need to have that shared vision, shared priorities, that we want to reflect in this strategic plan and try to use that as a device to influence these wider changes that are coming from beyond. So in terms of priorities, people will know that the HSP's role is very broad, but I think all of our activity across the breadth of the HSCP is guided by consistent aspirations and priorities, and I've listed some of them here. So our duty of care, obviously, to the individual is always paramount. The service user and patient voice must always be central to decision making and not subordinated to the professional, to the provider, or even to the carer voice, and that's not always the case, and hasn't been the case historically, but it should be. We recognise that most people want formal support that's proportionate to their needs, so they want to live as independently as possible from formal support for as long as possible, and our duty is to help them to achieve that. And again, that's something we try to apply across the breadth of our business. And key to that is working with individuals, families, carers and communities to build resilience at all levels in a way that will help people to live as independently as possible. And we want to deploy our health and social care resources in a way that benefits the most people in the most effective way to deliver the best possible quality of life for them as an individual and for the people that care about them. But we also recognise in practical terms that these priorities are sometimes easier to describe in the abstract like this rather than deliver in practice. So priorities are one thing, delivering them is something else. So if we could move to the next slide, that's okay.
It's really slow, Stephen, so just keep talking.
A wee bit. So the next slide is, which hopefully you will see in a moment, technology permitting, is really my reflections on co-production. So I'll just keep going until the slide comes up. And again, I know this is understood by this audience, but it bears repeating here that the HSCP is a large, complex organisation that exists within an even larger, even more complex health and social care system. So in the context of co-production, it means that although we do aspire to be a listening and respectful and responsive partner to individual patients and service users, to carers, to community organisations, to providers, and the kind of wider public, we don't always get it right, and we still have much to learn. So on that note of humility, I would want to start my reflections on co-production. I think another observation from me is that co-production, like a lot of I suppose a lot of kind of virtues, is easy to pay lip service to, and that can be tempting if you're maybe in my position, or you're in a pressured organisation with kind of time critical pressures facing you in every direction. So that is in conflict with the reality that meaningful co-production takes time. So words can be cheap in relation to this in so many places, but actions really count, and I suppose that's where I think the value of our conversation today and ongoing will come. So specifically, I think actions that share the HSCP's power in relation to decision making on policy, on service configuration, on funding, and on other resources is really where meaningful co-production can be found. And the HSCP does have an appetite to go further, much further in that respect, whilst recognising it's not always straightforward given the complexity of the environment in which we operate. And I know that there will be, in such a big organisation, there will be plenty of examples, large and small, of co-production, many of which I will only have a passing knowledge of, if at all. So I'm not going to try to reflect every or all examples of co-production across the HSCP. So as Sheena had mentioned earlier, I'm going to talk about the co-production aspect of the Maximising Independence programme, which will absolutely be central to the final form of this strategic plan. It will be at the heart of the HSCP and the IJB strategic plan. And I'll just quickly kind of describe for those that maybe haven't heard this and haven't heard much about Maximising Independence. We've worked through our thinking in relation to this, and where we've arrived is a view that maximising independence means it's supporting people who can and want to remain living at home safely for as long as possible, with the right support in place for them and for their carers if they have them. What it doesn't mean is just as important. It doesn't mean living without any support at all. It's about living as independent a life as you possibly can, making choices about the things that matter to you, and to live as full a life as possible with support when you need it. And so we will talk, listen and collaborate to build a sustainable way of supporting people so that everyone can achieve their full potential for health, well-being and independence. So that in a nutshell is the aspiration for Maximising Independence. And we've sought to take a co-production approach to that programme from the start. So we commissioned an independent research company to engage the public on the kind of emerging programme mission and vision. And we've adjusted the programme in response to the findings, sometimes quite a hard listen for us, but that's what we wanted. We have a partnership approach, and partners are full and equal members of the programme board that steers the overall activity of Maximising Independence. We've sought to share and disperse leadership of the programme across partners and not just hold it within the HSCP. Decisions, including those on how resources are allocated, and there's a budget of around 8.6 million attached to this programme, are made jointly and transparently. And crucially, I think in terms of co-production, certainly from my side, accountability for success and failure is shared by the partners. And I think in that context, it's fair to say that all partners take a risk on each other, and it does require a high level of mutual trust, and that takes time to develop. That's not just a given, it certainly isn't. And it's also delicate and can be easily lost. You can spend a year, 2 years, 5 years building a trusting relationship and then break it overnight. And that's something I'm very respectful of, and I think is a feature of any meaningful co-production. And I would also say that no doubt, and Sheena and Ian and others who have been involved in this will tell you, it's been an imperfect experience for partners. But hopefully they would also acknowledge, and without putting words in their mouth, that there has been a shift in approach that's a genuine shift in approach to greater co-production from the HSCP. So in terms of this programme, I think this year, 2022, is a critical one, where we're seeking to move beyond the kind of good shared intentions to practical actions that will benefit the city's people. So for example, and just to kind of make it real, we have the communities work stream. There's 5 work streams within the programme, one of which will be of interest here, I'm sure, is the communities work stream, which is led by Ian as the Chief Executive of GCVS, and has a budget of approximately £2 million within that overall 8.6 million, which is intended as seed funding to build community capacity in line with the programme's aspirations. And my hope is certainly that we use that funding to build an evidence base, garner successes, build an evidence base around those that make the case for further investment in community capacity as a more productive alternative to investment or continued funding in aspects of formal care, if we can demonstrate that that goes further and delivers better outcomes. And that's certainly something I'm open to as we go through this programme. I think that's a crucial aspiration for me. There's another work stream within Maximise Independence that focuses on engagement and communication that Sheena is leading for us, and that's developing a substantive plan to engage all relevant stakeholders on what partners need to do over the coming years to deliver the programme's aspirations, and that this kind of session is absolutely part of that and will inform the outcome from today. Will certainly be taken back in to inform what we do next as well. So it's all very much a work in progress, but I think as an exercise in co-production, it's already taught me some key common lessons about co-production. The first one is it's messy at times. Governance can be confused, tricky. You have to work through it. It's not all kind of laid out clearly, so you have to be willing to cope with that and work through it in a positive way. It relies on goodwill and mutual trust, and that comes from a lot of talking and dialogue. As part of that, disagreements are a natural feature of co-production and tension, but that's okay because that can be managed constructively rather than destructively, and that's got to be the aim for it to work. Practicalities can trip you up, so we all share frustration, for example, around procurement, and even trying to use small pots of money under Maximise Independence has run into barriers that we knew were there, but still frustrating around procurement, although we're getting great help and support in principle from legal and audit colleagues and so on. That's the law, and we need to see what comes out of that, focus on the move from market-based commissioning, and we hope that will help us in relation to all. And I suppose the other observation from me based on the experience of Maximising Independence is that co-production is worth it, because the key lesson from all of this, and I'm absolutely clear on this, is that the HSCP certainly doesn't have all the answers. And it should never think that it does, and it certainly can't deliver the best outcomes for the city's people on its own. Partnership is essential, and as we move into this new era for health and social care, I think Maximising Independence as part of this wider strategic plan really needs to invest in that co-production with citizens and with partner organisations and the wider body politic. As a central element of its approach, and that's the way we will find a way through the challenges that we will face over the coming years. So it's a quick run through. I'm sure we could all speak for days about the ins and outs of Maximising Independence, but it was more really a kind of angle on what it tells us about co-production and how that might inform our work around the strategic plan. So at that point, Sheena, if that's okay, I'll stop talking and obviously happy to answer any questions.
Great, thank you very much, Stephen. It's not a lot of time to give us an insight, but thank you for doing that. And I think for me, thinking about our events that we've had already, there's some really strong themes there around our service user, patient, people voice, the sharing of power that has come up in, I think, every single one of our engagement events. And if we're really going to co-produce and come together, we've got to share power and distribute power. So I know that can be a whole session on its own. And the learning, the imperfection, I think that's really important as well, that we have to try and build that trust and relationships and acknowledge where it's not going to be anything near perfect, but if we can improve, that's really what we're aiming for everyone, to make it a better experience for everyone. So thank you for that. I don't see any questions coming in yet, but Lynn might tell me she's got some. I'm not the queen of technology, so Lynn might have some questions coming at her from different places. And if anyone, I don't see, if anyone wants to sort of ask a question, they might prefer that to typing. If you want to put your hand up, there's a little reactions button at the bottom where you can put your hand up or smile or whatever you want to do to say that you would like to come in, or simply take your put your mute off, and then you could ask a question if you have a preference for that. Well, I see Richard actually. Welcome, Richard, from Glasgow's Golden Generation. Has a question. Hi.
Hi, how are you? Thanks very much, Sheena. Stephen, it's just a quick question, and it's quite a specific one in relation to transport strategies and older service users. So we're following council guidance at the moment, and we've got social distancing in transport, and I know that the council are still adhering to that at the moment as well. I'm not too sure if you know how long that will go on for, and basically whether that's a legal requirement at this stage. I'm finding it quite difficult to get an answer to that. And the crucial part at that point really is, with rising fuel costs, costing our charity a fortune to be, nipping out and getting 4 people and coming back and getting 2 or 3. And we've also got a massive waiting list of people wanting to come into our centres. So it's very challenging, and it's not easy for us to manage that. I'm just wondering if you've got any kind of opinion or steer on whether the council might relax that side of things.
Well, I don't think, Richard, my opinion counts for much in relation to this. But, I mean, all of these things have come through on the basis of public health advice and so on over the period. But given the amount of relaxation that's taking place in the wider world at this point in time, I don't know specifically what the position is in relation to that, but I'll certainly take it away and speak to colleagues within the council to try, because I think I've got sympathy for the issues that you're describing there, and if the public health view is it safe to relax that, then clearly the guidance needs to catch up with that. So if you leave that one with me, I'm happy to come back with an answer. It's not something that I've got a direct locus on at this point in time. That's great. Thanks. Cheers.
Thanks. I see Tressa has her hand up. Tressa, welcome from GDA. Nice to have you here.
Thanks so much. Thank you. Yeah, thanks so much, Stephen, for the input and for giving us the kind of presentation and the progress update. I'm genuinely happy to hear you saying that there would need to be, not that there needs to be, but there is space for difficult conversations and maybe tensions and disagreements if co-design and co-production are going to be meaningful, because I think from my experience, and probably yours as well, that is just absolutely true. The main thing I really want to highlight is the problem with what seems to be a confusing policy intent of maximising independence and the definition of what independence is and independent living. And certainly from our perspective, it feels like it's been, and this is obviously coming from members who are either in need of social care or are receiving social care through Glasgow, it feels like there has been a way of trying to minimise what people need and get from social care because of the I suppose the demands and how the budget is stretched, just the sheer demands on the service, which you referred to earlier. So it would be good to talk more about that. We at this point don't have any formal relationship with health and social care. We've got no way in directly, but we're working with you and we're talking at many different levels and feeding into some of the groups that GCVS has, which is great. And I'm also speaking directly to Suzanne Miller on a regular basis, which is really welcome as well. But I think one of the things for us as well, just to add to the point about the Maximise Independence policy and programme, is that the Disability Strategic Planning Group disappeared a number of years ago, and it's not something new that I'm saying, Stephen. I've raised this with Suzanne and others as well, but it's just worthwhile saying in this forum that was one route in for disabled people, and I'm not sure if it was disabled people and carers, but certainly disabled people with a range of impairments, so mental health, learning difficulties, a whole kind of spectrum of disabled people, and that's kind of been removed quite soon after health and social care integration was established. So just want to raise that as well. Thank you.
Okay, nice to see you, Tressa. Actually, coincidentally, I had a conversation with Jackie Kerr about the SPG for disability yesterday, and I know she's going to be in touch with you, if not already, around that. So she was saying that to me. So that is actually moving in a way that I think you will be happy with. But I'll let Jackie have that conversation with you as well, so I can reassure on that point. On the kind of policy intent to maximise independence, I think that's why we need to keep talking about it, because those of us that have been most intensely involved in it have moved, and we knew we would as we kind of develop our own thoughts around and hone that based on feedback and challenge and so on, and that is something that we are committed to do, which is what I was hoping to get across to the presentation as well. So I'll give you that commitment. Also in the presentation wanted to be clear about what it is and what it isn't, and it's not a programme that's intended to deny anyone the formal support that they need. It's about providing support in line with what people want and need to be as independent as possible. And there's a level of nuance in there, and we know even from the feedback from the market research that it can scare people if you use indelicate or insensitive language. So we're trying to get that right. I suppose my view of it is, and I am a bit more optimistic about the funding context we're going to be operating in as a health and social care system. There's lots of economic threats around the world at the moment, so nothing's certain. But in terms of political will, I think that has changed. But I would still, irrespective of the financial context, I still think this has got to be the right approach, because I think it's most likely to deliver the best outcomes for people as long as we do that in partnership. So that's my view of it. But we'll keep talking about it, and hopefully you'll feel sufficiently engaged through the SPG and other routes into the HSCP.
Yeah, and that conversation continues around the naming of the programme. So we've got our second lot of, through our comms and engagement work stream, our second lot of research going to start soon, because although we're all used to calling this maximising independence, we appreciate that the language is not what has a positive association for everyone. And I think for me, some of that's about the relationship and the intention, because we're not always going to agree on language, but hopefully as we build relationships and we get the language and the words right, for me, the actions are the critical bit that we get right. But my colleague Marion, we will be in touch around that in terms of engagement. So we've still got lots of work to do. And absolutely right, the conversation is ongoing. Yep, thank you. I see Alison's iPad, I think that's Alison Eccles, has her hand up.
Yeah, that is me, and this technology is new to me, so I'm not sure if I'm on. I think I am, because you're laughing at me. So
it's fine. lovely to have all our colleagues who are going adventurous and getting on Zoom today.
I know, it's very exciting. It was really just in response to, and Stephen's kind of covered it, to Tressa's point about the SPG. Tressa, I have emailed you just the other day. You wouldn't have got to. I know you've got a lot going on, and sorry to hear that, but I was wanting to get some time with you on the strategic plan, and Jackie wants some time in the SPG. So I've suggested that we all get together when you can make it.
Great, thanks, Alison. I don't see any other hands up, so I'm going to take the opportunity. If any hands come up while I'm talking, that's absolutely fine. Sorry, I've just spotted my colleague Tracy. There's a wee icon beside her, but I don't know if that's because she wants to come in. It might be my lack of awareness of what the icon is. So,
yeah, I'm not sure. I don't have my hand up. What's
okay,
the icon?
great.
Sorry.
Okay, that's fine. Thanks, Tracy. So if we don't have any more questions, we are going to take the chance to, we're going to be beamed into smaller discussion groups. And thank you to all our colleagues who are going to support those discussions. Now, those discussions are not going to be recorded. I mean, in the video sense, audio sense. They are an opportunity because this first session is around engagement, co-production, involvement in health and social care services and linking with the strategic plan. So we do have some sort of questions to guide us in those conversations, and they're about what matters to you or someone you support or your organisation at the moment and in the future. In relation to co-production and engagement with people who use services, what's going well, what could be better and why, and that's really important. You know, the what, you know, have we got some solutions, some suggestions? What would make a difference for you or somebody you support within your organisation? And the person who's facilitating will just be taking some key notes. We've asked that from each group we'll have about 3 key points. There might be more, and Lynn is kindly going to collate these so that people will have a chance. They're up on the screen now, those questions, so that people will have a chance to see what's come up from the session, because we're not going to go through them all today. We are going to have a short break before we go into discussion groups, so please do take a break before you go into the groups. And we've also got Jenny Miller, Chief Exec from PAMIS, who's kindly going to do some reflection and summing up before we close after our discussion. But we should have about 40 minutes, if my maths is right. Yeah, we should have maybe 35 minutes taking a break and then going in to the discussion groups. And if there's any questions within that, please come to us. Lynn will be out with the discussion, so if anyone wants to come out of a discussion to ask anything, please let us know. Okay, so we'll take a short break and then go into discussion groups. Lynn, in terms of our timing, 2:15 we're due to go in. Yes, so even if it's just after 2:15, if you need a bit longer to get yourself comfortable, then we'll start just after 2:15 in the discussion groups.
Yeah, great. And we'll assign you during the break, so the groups are ready to go. And if you find that you're not in a group, you come back, don't worry, we'll sort that out and you return to the room. So no time to just grab a few minutes to calm down and grab a cuppa.
Great, thanks very much, everyone. So hopefully everyone's had a chance to have some input and a bit of discussion around themes, and hopefully you remembered we are here to think about the strategic plan as well as lots of other issues that will be relevant to you. I'm just going to hand over to Jenny Miller, who we're delighted is here from PAMIS, Chief Executive at PAMIS. Delighted to have Jenny here to just give a bit of a summing up and thoughts on our discussions in this session. Thanks, Jenny.
Well, no, thank you. I'm not sure. I've just been really interested in actually hearing the conversations that we've just had in our group. And I suppose the one thing to say, though, is that actually having events like this that brings us together where we learn about each other is just so important. But I suppose looking at where we are now, we are in a new world, aren't we? We're in a place where none of us have ever been, ever. You know, we've just come, well, we're not even out of a pandemic. We've got a war going on, you know, we've got fuel poverty, and actually that coming out of a pandemic that none of us have ever been through, you know, in a lifetime. I think we need to take cognizance of the fact that that's where we're at. And I think that is also where we're at personally and emotionally and physically. You know, the people are exhausted, and now how do we get the energy to move on to the to the next thing that's coming up in our lives, and how do we get the energy to move forward in yet another consultation about where we want to go and where we want to be. It's a difficult place to be, isn't it? You can feel that tension, and I think people are really, really tired. We were reminded by some of our families yesterday that there are people that will never recover from the pandemic. They'll never regain the skills, that their health and well-being will never change. And although we were talking to the care inspector about what we might do differently next time, not convinced that we've learned all the lessons that we need to learn from where we've been. And I think we need to give ourselves, picked up what we were saying as groups, but also from what you were saying, Sheena, and what we were hearing from the strategies. It's going to take time, and it takes time to build back trust and relationships, and it takes time to recover from something that we have never experienced. So I think one of the things that is really great here, though, is that we were picking up communication. So we've been learning a lot about each other's organisations and what's worked. And one of the things that let's be hopeful about is that if we collaborate and come together and we do co-produce, we'll end up with learning about each other, not duplicating and thinking about how better we coordinate services. But certainly from our group, one of the key things was that coordination. How do we not duplicate? How do we accelerate things that are working really, really well? And how do we make sure that everything we're doing is reflected back to the people that use our services? And I suppose there is this huge plea, Gina, from the third sector that actually I think the third sector we know that we've saved lives over the pandemic. And I know that there was a thank you this morning for everything that the sector has done during COVID, but I suppose that needs to translate into a way of enabling us to work co-productively with statutory sectors, for us to engage in a meaningful way with the people that use our services. But that will take funding, and it will take, I think it was you, Elizabeth, that mentioned longevity. You know, we can't work on a year-to-year basis, because, you know, and those relationships can't be built in a short period of time. So I think, you know, funding is going to come out, that transparency about how the funding is developed, you know, how are services going to be procured, how can we make sure that we're not competing with each other and we're actually working collectively, and how do we communicate effectively so that we, you know, I mean, communication has been a nightmare. It's quite harrowing hearing, you know, a member just talking about, you know, people, we remember that desperation, don't we, when people didn't know where to go for their shooters, they didn't know where to go for, you know, their testing, you know, all the communication that suddenly need to be looked at. And one of the things that we were also talking about was, do you know, the government rose to the challenge of how to get funding out to the third sector in a way that has never been done before. And can we learn from the fact that actually we were seen as the people that knew what was needed at the grassroots level? So how do we maybe build on those lessons that were learnt, and make sure that we take that forward as we go? Yeah, so communication came up, isn't it? And connections, which, Sheena, you're the world's best at making us all connect together. And that ability to be able to work upstream and to do things differently is going to be a mammoth culture change. And how do we work with organisations that have been so used to working in a different way to manage that? And I love that. We need to talk. We need to have updates. We need to be able to share experiences, but we need to learn how to listen, don't we? Yeah, sorry, Sheena. I think I've just been hit by just how difficult it is at the moment, I suppose, and you know, how tired everybody is. And I think we're going to have to acknowledge that as we move forward. I remember being in a group, Sheena, and there was somebody from a health and social care partnership who said, you know, we're struggling, we don't have any staff. You know, we've got people that have retired, we've got people that are really tired, and now we're in the middle of a mammoth change. You know, we're coming out of COVID, we're hitting a new health and social care policy. We're now looking at a new national care service. How the heck do you expect us to do all of that in really short timescales? So I suppose there's a plea about time, there's a plea about funding, and there's a plea about how we communicate and support each other to do that, really. And together, I suppose that's my final thought, is if we do it together, I often think we're often asked in the third sector what the challenges are and how we might manage them. But if we looked at those challenges together with the statutory sector and how, what are those wicked questions that they're coping with, together we could come up with solutions. And I always use that word. Profound means deep, wise, expert. People with profound disabilities have taught us how to work together, because they don't really care who does what. They just want you to get it right. And if we do that together and we learn from each other, our collective wisdom might help us move forward. But I think we have a lot of challenges ahead, and and I think we need to be kind to ourselves. I'm really sorry, Sheena, I'm not sure that was exactly what you wanted, but those are my thoughts from
Thank you,
executive.
Yeah, thank you, Jenny. Absolutely. It's that note on together, I think, is really important, and I think it was really good to hear, at the start, Stephen talking about that the partnership doesn't have all the answers, it's not going to be perfect, an acknowledgement of what's been and that we can improve. And I think certainly in our group we heard some of the themes that you were talking about, Jenny, and really needing to acknowledge what everyone's been through. And I don't think we can truly do that, understand how horrendous it's been for a lot of people. And I see that having listened to a lot of people last year talking in all our events and beyond. But there's something about how we acknowledge that and how tired everyone is. And we're trying our very best to come together and make, but there's something about, a lot of families are still, life is not going back to normal, as you said, that your people in PAMIS have told you, and so in terms of planning, how do we acknowledge that and maybe have to adapt plans or aspirations that we had to get the basics done? Because we've been hearing that, haven't we, that people's basic needs have not been being met, and we've got highfalutin ideas about co-production and whatever else, and actually we need to get the basics right. So there's something about our planning, being aware of that for all of us, and that kindness message as well with each other, but not stopping us actually getting on with some really important work. And I think this is the first of a series of conversations around strategic planning, and it's kind of reassuring to me in a way, because commissioning and planning and engagement with the sector are all themes that we'll have more time to talk about. So this first session is sort of reinforcing to me that those are the right themes. Not that I would doubt my manager Ian and his work with the third sector, of course, but it's really good to hear, that these are important themes. And I think that I've said this before, I don't think recovery is the word, because we're not near recovery, and some people that is going to take a very long time, if at all. But whatever's coming next, we need to mobilise and come together, which is why it is so important that we have these events. Thank you for trying to sum all that up for us, Jenny. I don't see any hands up, but we've got a couple of minutes. If anyone does, I'll give them a chance to come in, but I do want to say a huge thank you to everyone that's contributed today, our speakers. Thanks to Stephen and Jenny for inputting. Thank you to all of our team, to Craig and Alison and the strategic planning, and Jane. Jane appeared as a note taker in my group. I felt very, very spoiled. To our facilitators, we've had Stephen, and two Alisons, Alison Eccles and Alison Noonan, Jenny and Stephen. So a huge thanks to everyone and for everyone coming together to have this conversation. It really is appreciated. And if you've been in a group and taken notes, can you please make sure you send them to Lynn? I think she might have put her email in the chat. And thanks to Lynn and Tracy for making sure we could connect and get into rooms and out of rooms and all of that. Apologies, I saw in the chat there was a bit of technology issues for people getting agendas and things, so we'll try and make sure we do that better for next time. Jenny, anything you want to, are you comfortable with?
Yeah, no, there's some brilliant comments in the chat. You know, I think they'll be really useful to collect and take forward. But no, thank you, Sheena, for facilitating. I think it's really helpful having us together, and I'm looking forward to writing the notes up and sending them on to Lynn. So look forward to them.
Thank you. And we'll send out the presentation, Stephen's presentation, and recordings, and that'll go with the notes as well. And that's us. Thank you very much indeed to everyone.